Hello, Professor. This is Navita Garg. Today's my topic is shockwave therapy. In this presentation, I will discuss about what is shockwave therapy, what are the indications, contraindications, how it used, what is the history and background of shockwave therapy, and what are the research findings occur on shockwave therapy, and how I experience with shockwave therapy. So let's begin. First of all, there is a non invasive therapeutic modality. This is used in the field of orthopedic and traumatology, also used for the treatment of many musculoskeletal disorders and soft tissue injuries. And also, it has ability to promote the tissue repair and pain relief. And this is the important fact that shockwave therapy is approximately 1000 times better than ultrasonics. How it works: it promotes the neurovascularization at tendon bone junction, then it stimulates proliferation of tenocytes. After that, it inflates the leukocytes and amplify growth factor and protein synthesis. At last, it stimulates the collagen synthesis and tissue remodeling. What are the indications? As you can see in the picture, mostly it is used for musculoskeletal disorders like in the upper and lower extremity, like in the shoulder, elbow, hand, knee, hip, joint, and greater trochanteric pain syndrome, medial tibial stress syndrome, patellar tendinopathy, plantar fasciitis, achilliotendinopathy, adhesive capsulitis, non invasive of long bone fracture, and a vascular necrosis of femoral head. How it began: during Second World War, it is first absorbed in the form of explosion of water bombs. In 1950, there is a first systematic investigation of these of shock waves in medicines have been performed. And then in the USA, the first patent of electrohydraulic shockwave generator was accepted. End of the 50s, physical properties of electromagnetic generator shockwave has been described. And then in 1960s, 96, shockwave was initiated at Dornier Company. Then from 1968 to 1971, there is an interaction between shockwave and biological tissue in animal was investigated in Germany. Then in 1985, forest experiment was carried out to investigate the influence of shockwave therapy on bones, and there is a successful treatment of epicondylitis and heel spur with reported success rate 70 to 80%. There are numerous research findings like shockwave therapy is a modern physiotherapeutic method useful for treating musculoskeletal conditions like low back pain, and also it appears to benefit patient with myofascial pain syndrome of the trapezius. It is efficacious and safe for reducing pain and improving knee joint in the patients of osteoarthritis. And a recent clinical trial shows that shockwave therapy is significantly reduced Peyronie disease pain. Peyronie disease is a disease which occur in the penis in males during erection of penis, and there is a plaque formation around the tissue of penis, so it helps in reduction the plaque formation. And it is being explored as a promising treatment for nerve injuries like carpal tunnel syndrome, so it reduces the pain and improve the nerve function. There are several contraindications too, like there is an active infection, malignant tumor, and pregnancy. In these conditions, we can't use shockwave therapy. And also, there is a relative contraindication like brain and nerve tissue in treatment focus, lung or pleura in treatment focus, significant coagulopathy, epiphyseal plate in treatment focus. There are some side effects too. Might be after using of shockwave therapy, there will be a pain, local inflammation, bruising, paresthesia, arrhythmia, and soft tissue damage. I experienced shockwave therapy in India on multiple conditions like myofascial tightness, neck, back, and hamstring, and also used to break the trigger points. It is I also used in plantar fasciitis and tendonitis. Even I have acute throat tendinopathy, so I took multiple sessions for this. And the result of shockwave therapy are really appreciated by patients. So it helps in reducing the pain and tightness, and of course, more beneficial than ultrasonics. Nowadays, it is trending, but it is costly though. So, very few people have the shockwave therapy, and if they have, then they put extra charge for this. But it is using worldwide now, and it is the latest technique of USA. So, some people try to compensate the shockwave therapy. They use Theragun instead of shockwave therapy in India and USA. So that's all about shockwave therapy.